Talofa, my name's Anoushka. I'm one of the nurses from the primary health nursing team. So why does asthma get worse in autumn? Well, as we move into the colder months, the air becomes cold, it can become quite damp and full of viruses, and all of these can trigger asthma. Colds and flus are much more common, and these can irritate the lungs and the airways. We also spend more time indoors where there can be dust, damp housing and mould in many of our homes. Cold air itself can tighten the airways, making it harder to breathe. So who is at most risk of asthma in winter? People who are most at risk are our tamaiti, our children, and older people. They are the most vulnerable. Also, people with existing asthma or respiratory conditions, or families living in cold or damp homes. As a community, we can check in on our ainga, our family, especially elders and our young children. We need to keep our homes warm, dry and well ventilated. We're encouraging flu vaccinations and regular use of preventer inhalers. So how can you manage your asthma well this autumn season? So take your preventer inhaler every day, even when you feel well. Always have your reliever inhaler with you and use a spacer, especially for children. It helps the medication work better. Keep warm. Cover your mouth and nose in cold air and reduce triggers at home. Wipe away any mould. Open windows where possible and act early. If symptoms start, don't wait. Get it seen to early. You can come to our nurses at Pacific Health Service. So these are the times when you need to seek urgent help or when there are any red flags. So if you see any symptoms of struggling to breathe or breathing very fast, unable to speak full sentences, lips or fingers turning blue or grey, and when your reliever inhaler is not helping, or if your child is very quiet, tired, or working really hard to breathe and you can see their chest sucking in. Having an asthma plan is very important because an asthma plan tells you what to do every day, what to do if your symptoms are getting worse. It helps you and your family feel confident and in control. It can also help visits to the hospital and serious flare-ups. So if you see any of the red flags that I had mentioned, please feel free to see one of our expert nurses at Pacific Health Service for ongoing asthma care and management. Malole soifua, manuia le aso.